now joining us, we have Jenny from the Smoky Mountain Center, and she's got all kinds of things to talk with us about today. Thank you so much for being with us.
Thank you for having me.
Absolutely. Now we're going to start today by talking a little bit about a survey that you guys recently did across all 23 counties that you serve, correct?
That's correct.
Very neat. Tell us a little bit about this survey.
Sure. One of our missions is to build community capacity and have stronger communities in support of people who are perhaps experiencing mental health issues. So we surveyed across all 23 counties, that includes Watauga, to find out what issues would be of interest to individuals affected by behavioral health issues, by entire communities. And we hope to have maybe a response rate of around 300. We had a response rate of 650 the last count.
Wow.
So we had a huge response, which has been very helpful in identifying what issues we should focus on with community education planning in the next year.
Very neat. So double what you expected.
Absolutely, which I think tells us that our communities are ready to learn more about behavioral health, and then they in fact want to be active, and that perhaps the stigma around behavioral health is actually reducing, which is a very positive and healthy thing for our communities.
Absolutely. Now what can you tell us about this survey? What kinds of questions and information?
Well, our hope was to find out what people wanted to learn, how they wanted to learn it, and where and when they wanted to learn it. And we weren't too surprised about any of the results. People are more interested in learning in alternative ways, web-based learning, but still people prefer face-to-face. They prefer that opportunity to come together to learn.
Right.
People want to learn at the typical times, not so much nights and weekends, mostly during business hours during the day. They want to have the learning presented in public places and neutral places. Public libraries rank the highest in terms of location. The issues that they want to learn about, first and foremost, access to care, which is very encouraging because that's a high priority for us.
Right.
They wanted to learn about the signs of mental health, which is also encouraging because we hope that will lead people to do more early identification. They wanted to learn about prevention, which is very exciting to us because that's high on our list. And they wanted to learn about self-care, living in health, and self-advocacy. So we think we can approach all of those issues as high priorities over the next year.
Very neat. So talk with us about what you guys are doing now and how you're going to take the results of this study and implement it.
Sure. We will continue to do community forums to interact with our communities. We'll continue to do wellness events. We will also offer what we call evidence-based programs. These are educational programs that have been proven to be effective. And we have about 8 of those that we have become certified in and we're able to offer. And we have already started offering some of those programs. As we move on into the summer, we'll see even more of those offerings. For instance, 2 of those are mental health first aid, which really addresses early identification and teaching people across the community about how to identify symptoms, signs that a child or an adult may be needing help, may be having trouble. We're also offering a program called Wellness Recovery Action Planning, which focuses on people who are having some experience with substance abuse or mental health, and they want to live in greater health. They want to be well. They want to experience a long-term recovery plan. So those 2 training packages already are being offered. In fact, in a neighboring county today, we are doing youth mental health first aid in Ashe County. We offered RAP in this county already, offered it in Wilkes County already. So you will see that these offerings will come out someplace every month across the 23 counties, those and other offerings. Another program that's really important to us is Darkness to Light, Stewards of Children. It really ties in with your last guest because it is a program to help people in the community who are in contact with children understand how to protect those children from signs of abuse, from episodes of abuse, and to make our community stronger in response to that. So those are some of the offerings that you'll see coming up.
Wow, so lots of things on the agenda. Now, you mentioned earlier kind of the stigma that comes along with mental health. Talk with us a little bit about how studies like this and programs like the ones you guys offer kind of help to combat that.
Well, I think it's just a matter of offering opportunities for members of our community, all kinds of people, just people who are neighbors, people who are teachers, basketball coaches, youth ministers, anybody from any walk of life, just to learn more about behavioral health issues, how to see when some child or some adult is perhaps in need of help, and then how to make good referrals to get them the help that they need. If we continue to have those conversations, the stigma will be reduced, we're confident.
Definitely. Now talk with us a little bit about Smoky Mountain Center. For any of our viewers who are not familiar, you guys do a ton of great things here in the High Country. Tell us a little bit about it.
Absolutely. We are the local management entity, the managed care organization for all of the Medicaid funds that come into behavioral health. And that means that we manage the network of providers. You have many good providers here in this county and in neighboring counties, so we work directly with them. We also do a lot of work specifically with consumers, with family members through our care coordination department. And then our community collaboration department does a lot of systems interaction like this community education plan. And here in this county and the surrounding counties, you have a person dedicated to that effort, and her name is Robin Winkler. She works right here in Boone. I wish she could be with us today, but she's actually in Ashe County doing training today. But you can find Robin on our website. You can find a community events calendar on the SmokyMountainCenter.com website that lists all of the training programs that are being offered and the locations of those. And of course, we'll be adding events to that calendar all the time, so that calling Robin directly and talking to her or going to the event calendar would be a great way to find out what's going on in the community.
What a
Sounds
rewarding
fantastic.
job. Once again, I was telling them, our last guest, but you have a more rewarding job as well.
I really believe that I do. I get to work, cooperatively with people who are working every day to make our communities healthier, safer, to help people who are experiencing difficulty. But I think one of the most exciting aspects of the work we're doing now is that we're planting seeds for the future. All of these community education programs are really directed at the generations to come. If we can intervene now to have healthier children, healthier families, in the next generation, the generation to follow, we will have fewer individuals who are experiencing serious mental health issues and substance abuse issues. And there's just tremendous research that tells us this is absolutely true. And if we stay the course, we offer these programs, we educate our communities, we'll have healthier children, healthier families in the future. So it is exciting. It's a great opportunity.
Absolutely. Now, Smoky Mountain Center has been around for quite a while, correct?
Quite a while. The history is quite long, decades long. But interestingly, Smoky Mountain Center started in the far southwestern counties of North Carolina. But as there's been mental health system change over the years, some of those, what used to be called local area mental health programs, have consolidated and joined. And now this is a large 23 county area. And the name is Smoky Mountain Center, but it does cover all these counties that were earlier affiliated with smaller area programs.
Very neat. So all kind of under one big umbrella now.
That's correct, and there's a lot of strength in that size. There's a lot of sharing of knowledge and experience, but the really beautiful part is that we still have a very local presence. You
Right.
have an office in this county, you have care coordination staff in this county, you have Robin Winkler, who is your community specialist on the ground in this county and in Ashe and Allegheny, Avery, Wilkes, all these counties around. You have folks right here locally taking care of your needs, collaborating with other folks in your community, and making plans for a healthy future.
Which is so, so important.
Absolutely.
Now, can you talk with us at all about how things have changed since Smoky Mountain Center started so many years ago? How has kind of the things that you guys need to do and the community response, how has all of that kind of come together?
Well, I think we have gotten better and better at what we do. I think that perhaps we feel often that we don't have enough resources, that we're not able to have as many healthcare providers and take care of them as well as we would like to, but it's certainly that is our effort going forward. I think one of our great concerns is that while we're trying to do prevention and early intervention, we still have a great number of people who are not accessing service or who are ending up in crisis. So we always want to talk about ways to access service and ways to get help in crisis. And for this county and the surrounding counties, getting help in crisis is very easy. You simply need to call 264 HELP, and you have a crisis team, you have a dispatch team, you have a live voice 24/7 to help anybody who's experiencing a crisis with intellectual disability, substance abuse, or behavioral health.
That's very important to know. A lot of people, I'm sure, did not know that we had that hotline.
And it's always there for you. It's an interesting thing. We need to keep talking about it because it's not something we think about when we or someone we care about are not experiencing crisis. But when they are, this is the resource that we really need to remember to talk about.
Definitely.
Absolutely.
Now, any advice that you can give someone who may be struggling with some things, but maybe isn't sure if they're ready to seek help or is maybe just afraid, what would you say to them?
I think there are at least two resources that I can offer. And one is we also have a 24-hour access to care line, and that will work for crisis too. And that number is 800-849-6127. There's always a live voice at that number. And that's a number anybody can call and say, I just have a concern, I have a worry, I've observed something in my child that concerns me. I'd like to learn more about what services are available. So that is an access to care number that's available 24/7.
Fantastic. Now tell us what you do at Smoky Mountain Center.
Well, I have the pleasure of leading the Community Collaboration Department, which oversees community education. It also oversees our Customer Services Department, which has a community-based advisory council. You have many citizens here in these counties who sit on that committee. We have a Human Rights Committee also in that group. We have a Transition to Community Living program. We have so much going on. We have crisis specialists. We have hospital liaisons who help people move out of inpatient care back to the community. It's a very large department that really just works with our communities, all 23 counties, on systems issues, and also help make sure that people do get access to care and do get linked in with care coordination and other services. In our department, we have something called peer support specialist. We have family partners. All of these folks are people who've actually been in this system. They have some lived experience, either through their own personal experience, family member, child with special needs. These folks are navigators. They're people who can offer support to anybody who is experiencing issues now and maybe not quite sure how to get help or just needs someone to talk to be offered hope and support. So the peer support specialist and the family partners are two of our wonderful, wonderful sources of help for people.
Sounds great. It sounds like there are a ton of people involved in the Smoky Mountain Center.
There are a ton. Yes, it's a large, large team, but again, we're spread across 23 counties, and we're very committed to having this very local presence in every community. And we have a real keen understanding that every community is different, every culture is different, so there is no one-size-fits-all answer for any community. If we don't have people on the ground, in meetings, in conversation on a local level, we don't really know what a local community needs, and that's our effort, which kind of brings us back around to why we did the community education survey. You know, the results for Watauga County were not the same as the results for Buncombe County or the results for Caldwell County, so our planning is really tailored to be responsive to each community.
So every area is different.
Absolutely, absolutely.
All right, well, it sounds like you guys have a ton on your plate, are doing a great job, and are very actively involved in the community. Thank you so much for coming in to talk with us.
Thank you for the opportunity.
Absolutely, and we will be back right after these messages with more of the Mountain Television Network.